Hello, I'm Shalina, and today I will be demonstrating how to measure blood glucose and mixing and administering insulin. So first, we would verify a doctor's order and identify our patient. Explain the procedure to the patient. I'm going to check your blood sugar today. We will perform hand hygiene and apply clean gloves. And if it was a real patient, I will tell my patient to wash their hands and dry them thoroughly. And then I will stick the side of their finger. But I have a baby, so first I will turn on my device. Put my glove, place this strip in the meter, and it prompts me to collect my blood now. I have my baby foot here, and then so I will stick the side of their heel. I will clean in a circular motion, allowing it to dry. My lancet is here. I will place this lancet inside this device to actually stick my patient. So I will stick the side of the heel, telling my patient it's going to be a big stick. And then I will wipe off the first drop of blood, squeeze gently, and then apply that second drop of blood onto my device. Now my device tells me that my patient blood glucose is 252. So I will explain that to my patient and let them know that I will be bringing them some insulin because their blood glucose is elevated. So now I will turn off my device, remove my strip, and place it in a biohazard bag. And I will disinfect my device as well. I'll remove my gloves and I will perform hand hygiene. And then now I will document my patient blood glucose level. I will document the procedure and how my patient tolerated it. All right, now we will move on to insulin. So first, you can go over the medication rights. You have right route, right medication, right dose, right time, right documentation, and right patient. All right, and other insulin delivery methods is the sub-Q injection, which is what we have here today. You have an insulin pump, insulin pen, and insulin inhaler. All right, so we will verify my doctor's order and compare the order to the MAR and making sure we have the right patient. Now we will check out both of the vials, check the expiration date, make sure it's still in date, and then we will roll the vials. Perform hand hygiene, apply gloves. All right, have my insulin needle here, and I will inject this needle at a 45-degree angle, depending on the patient's size. So first we will clean our vial off in a circular motion. All right, so first, I will aspirate 16 units of air. And I will inject it into my NPH. Now, I will aspirate 6 units of air and inject that into my regular. Now, I will withdraw 6 units of regular insulin, making sure I do not have any air bubbles. Now I will draw up 16 units of NPH, and that equals out to be 22 units of insulin. Make sure I don't have any air bubbles. Recap my needle by using the scoop method. Maintaining sterility. I will let another nurse verify this dose, making sure that it is correct. And I would label this syringe with the patient name, dose, and the name of the insulin, just to be sure that I know what is in this syringe. All right, now remove these gloves, perform hand hygiene. Now I'm entering my patient room. I will verify my doctor's order once again, comparing it to the MAR and my medication, making sure everything's correct. That will be my third check. And then I will identify my patient And also asking my patient what site do they normally use to give their insulin injections, making sure I avoid that site. Also assessing the skin as well. Sites that you can use for injections is the back of your arm, your abdomen, and in front of your thigh, and where there's subcutaneous tissue in those areas. And also we can go over some hyperglycemia signs and symptoms. So you have polyuria, what is for hyper. Now you have polyuria, polydipsia, blurry vision, and dry mouth. And for hypoglycemia, you have diaphoretic, clammy skin, jitteriness, and trembling and confusion. All right, so now we'll get ready to administer the insulin. I perform hand hygiene already, and I have my new gloves on. All right, so I'm going to pick a site, and my site is my abdomen. I'm going to use this. All right, I have my insulin here. I'm going to pinch the skin, clean the skin, circular motion. Allow that to dry. I'll insert 45-degree angle. Warning my patient it's going to be a big stick. Insert it. Insert the medication very slowly. And then I will hold 10 seconds, making sure all the medication has been absorbed. Remove, and I will place this needle in the sharps container. Do not recap. All right. Then I would remove my gloves. Wash my hands, and then I'm going to document the procedure, my patient blood sugar level, how much insulin I administered, and the site that I used, and how my patient tolerated it. And that is all. Thank you.